Hello and welcome. My name is Leslie Gutierrez, and for this project, I developed a RISE articulate module titled Be Fast to Spot a Stroke. This main page will provide a description of the module and subtitles. The purpose of this training module is to equip non-clinical staff at HCD Lakeside Medical Center with knowledge and confidence to recognize the signs of stroke and respond appropriately. This course should take about 10 minutes. By the end of this course, participants will be able to identify common signs and symptoms of stroke, understand why every second counts during a stroke, take the critical steps required if they suspect a patient is experiencing a stroke. Below are the subtitles of this module. I will review each section by clicking Start Course. Introduction to Stroke. Why the rush? Approximately 1.9 million brain cells die every minute in a stroke. Option for audio on each image. Clot-busting medications can be given in the first 4.5 hours from the start of the symptoms. Untreated stroke can lead to lifelong disability and even death. It is usually the non-clinical staff that are first to recognize someone having a stroke. Continue. References. Resources. The course uses the Be Fast framework, an evidence-based approach to stroke recognition, and emphasizes early identification and rapid response to improve patient outcomes. Research shows that clear visuals, concise messaging, and multimedia instructions enhance understanding and retention, particularly for learners without a clinical background. Open parentheses, Clark and Lyons, 2010, semicolon, Major, 2009, close parentheses, dot. This course includes images to support engagement and reduce cognitive load in alignment with multimedia learning principles. Open parentheses, Major, 2020, semicolon, Clark and Major, 2016, close parentheses, dot. References below. Continue. What is a stroke? 1. Our brain needs blood flow in order to work correctly. 2. If this blood flow is blocked, the patient will experience an ischemic stroke. 3. If a blood vessel bursts, resulting in both lack of flow and buildup of pressure in the brain. 4. The patient will experience a hemorrhagic stroke, brain bleed in both scenarios. 5. The patient's brain isn't receiving the blood flow it needs to function. 6. This is an emergency. Continue. How to spot a stroke. Remember the acronym Be Fast? Balance, sudden loss, eyes, vision changes, face drooping, arm weakness, speech difficulty. Time, call 911 immediately. Continue. Here's a 1-minute video that you can watch. Continue. What to do? Flip cards are included to promote learners' engagement and interaction. What should I do in this situation? Stay calm, trust your instincts. If you think something is off, call for help. Should I call for help? Immediately call for help. Should I call 911? Dial 911 from anywhere outside the premises of Lakeside Medical Center. Dial 0 from within Lakeside Medical Center. Do I stay with the patient? Stay with the patient and ensure their safety. Is there anything else I should do? Note what time symptoms started. This is extremely important. Continue. What not to do. Flip cards and arrow buttons are included to reinforce key concepts and promote learners' retention. Should I wait to call for help? Do not delay calling for help. Should I wait till the patient gets better? Do not wait to see if the symptoms improve over time. Could I delay affect patient outcomes? This could have a major effect on the treatment the patient is able to receive. What does clot busters do? Remember, clot busters can only be given in the first 4.5 hours of the start of the symptoms. Is treatment critical? Waiting too long, there is very little treatment available to help patients. Should I call 911 for medical assistance? Remember, time is brain. Call for help immediately. Continue. Key takeaways. Recognize and act. Be fast. Time is brain. Get help immediately. Continue. Closing. Thank you, Stroke Ready Education, for non-clinical staff.